My name is Tim Flanigan. I'm Professor of Medicine at Brown University, and it's a great pleasure to be here. Before starting, maybe we could thank the good Lord for getting us here safely, for helping us work well together, and for helping us in all our work with children and families, both with HIV and with tuberculosis.
Я не в том плане плохого.
Но когда у нас есть риск.
Или вы видели какие-то побочные эффекты?
Question: what is the reason for the mother's cough?
The situation with both HIV and with TB in children in Ukraine is quite severe. There is quite a lot of both. When we met with Dr. Komar many months ago, she said we really need a conference to bring together both the HIV experts and the TB experts, because for the child or for the mother or for the father that has both TB and HIV, it's not good enough to treat just one or the other. We need both working together in partnership in order for that person to get better.
The main reason is that TB and HIV services have been centralized, and the system for treatment of TB HIV infected people is centralized as well. That's why most of the doctors don't treat TB, because the service is so centralized, and most of the doctors don't know about HIV because it's a new problem unlike tuberculosis, which has been with people through centuries. Unfortunately, TB services are not competent enough when it comes to infectious diseases, which was a lot of nonsense that created the situation we have today.
Фтизіатрична служба, вона не володіє питаннями інфекційних захворювань.
One of the most important things to do when you're faced with a child that you think may have TB is to do an HIV test, because that's going to alter your management, because that child needs HIV care as well as TB care. So there's integration of indicators and of diagnostics and of treatment. And often in our setting, if a child would come to hospital for care, the same doctor would manage the HIV and the TB care at the hospital level. And that has increasingly become the norm, that within the same healthcare facility you can access TB and HIV services for adults and for children.
This is a very helpful symposium in our fight against HIV and TB infections, because TB and HIV doctors can make connections with each other, especially with the main topic of today being children and their health is the most important. So I think if we will keep having such symposiums in the future, we will find more practical ways how to fight HIV and TB infections.
Бороться с этой эпидемией туберкулеза, ВИЧ-инфекцией.